guys, welcome back to my latest video. This is Crosby. He's from the Nomad Nurse, which is his YouTube channel. So I will have the link down below for you to check it out. But basically, like, sum up what you do on your channel so that people...
Right. So on my channel, basically what I do, and I talked about it in my last video, was I do a mixture of travel videos, like travel nursing videos. I do a mixture of nursing advice and basically daily vlogging. So I kind of put it all into one thing. Even though it's called the Nomad Nurse, I just kind of do everything on there. But there's always something to do with nursing, nursing-based videos.
Yeah, and he's a travel nurse, and he came down to Arizona to visit, so he's been visiting. We've been having fun, and we wanted to do kind of like a funny style video for you guys. I'm an ICU nurse, as most of you know. Crosby's an ER nurse,
yes.
And just like getting to talk over these past couple weeks, like we've been talking about like the differences of ER nursing versus ICU nursing, and we kind of wanted to like make a video, make fun of it in a way, but you know, no one don't get offended. We just,
yeah, we're not directly talking to anybody when we say this stuff. It's just some little things that we notice.
Yeah, so I think the most obvious we both said is like personality-wise, ER nurses are very like disorganized.
Very disorganized, and
fly by the seat of your pants.
Yeah, and ICU are definitely OCD. They have problems. And
I think it's a good problem to have.
Yeah, well, and here in Ashley's house, you definitely know how OCD she really is.
And like, just to give you an idea, I even wrote down like video ideas and things that like to plan for this. But like, have you ever seen that picture on the social media, like that it's all the wires and it says like ER nurses and ICU nurses, and the ICU one it's like everything's straight and organized, and ER just like super tangly.
Yeah, that's a perfect representation.
Yeah, I think it's funny. But I think that both, I mean, obviously, like, that's the personality type that usually suits well for that environment. Right. So, like, there's nothing against being more kind of fly by the seat of your pants or organized.
Well, yeah, absolutely. I mean, you can't have that type of mentality like in the ER and go to the ICU, or vice versa.
Yeah.
Like, you can't do it.
Yeah. And, like, you guys are more, for people that don't know, like, you're more focused on, like, the main issue. Someone comes with chest pain, you're focused on chest pain.
Right.
Whereas in the ICU, like, you're literally focused on anything. It doesn't matter if you come in with pneumonia, like, I'm still concerned about your kidneys and your liver. Like, I'm looking at everything every single day, labs and trends and stuff. And you guys are like,
we're like, treat what we need to, either get you out or admit you. And like, that's how we look at, you know, all of our patients really. It's like, what can we do to fix you, or what can we do to get you out of here? I mean, because you know, that's what ER is that, you know, we either treat you and get you home, or you're going to be admitted to the hospital.
Yeah, treat and street.
Treat and street, that's it, yeah.
So I think this is kind of a funny question, but like, what's your biggest pet peeve of ICU nurses? Like,
oh man,
where do I begin?
I can go all day.
And
on
I know
this
you
one.
have to have some, because when you give report to ICU nurses, I've heard a lot of things where like ER nurses get frustrated when they ask certain questions.
Well, yeah, because like, I mean, at the end of the day, you know, we're trying to get people out of there, and like, we have a waiting room full of 8, 10 people, or however many. You know what? An ICU nurse wants to sit there and try to find out every little detail. I'm like, it's all in the report. Here you go. When I call for a report, I'm like, hey, you know, what's going on? Here's what's wrong with them. You look at the notes. This is it. Like, this is the medicines they have. And then the ICU nurse is like, well, what was this running at? Or what did? And I'm like, oh God, just take the patient from me, please. But yeah, you know, that's pretty much my pet peeve, is like all the questions that you guys ask.
I feel like, and it'd be funny if like you had to, I was gonna say I wouldn't give you a report, but that'd be going backwards. If you ever gave me a report, if you could, like, I don't know, because I feel like personally, like, I have this mentality, and it doesn't matter if I'm getting a patient from the ER or like a rapid response from a different floor. Like, I would rather, like, some ICU nurses will be like, wait, my room's not ready, I need to get my stuff, or like, wait, I'm too busy, I'm with my other patient.
Oh wait, I got it. I know what my biggest pet peeve is. Now that you just said that just reminded me. My biggest pet peeve is when I take the patient upstairs and the room is not ready, or they'll have like the IV pole in the desk. I'm like, pull the dang bed out, have it ready, and like, there's nothing ready in there. That is my biggest pet peeve for sure.
I will say, like, I'm the type of person that's like, I would rather just take report and not delay the process any longer and get the patient up there, because like at the end of the day, like a patient on a tele floor that's like going downhill needs to be in the ICU, or a patient in the ER when you've got 3 or 4 ICU status patients and you're busy, like it's safe for them to get up to the ICU. And you know, I mean, I try to always have my stuff ready, but it just
I mean, and honestly, really, it's not really as much ICU as it's all like just taking. You can go to a med surg or the CPU, cardiac progressive unit. Anybody is just you know, I mean, nurses get extremely busy at the end of the day, and like there's just, you know, you can't do it all. And like I just look at it from my perspective is like, and it's very selfish. I'm like, I want to take this patient upstairs, get them there, and then go down, and I got other patients to worry about.
Yeah.
So.
No, I get it. I think I was thinking about this, like what my biggest pet peeve would be of ER nurses, and like I don't want to say I don't have any, but I feel like mine would be, and this is just like, I understand this is not like a part of like your job, but like when patients come up and they're just like saturated dirty, like they're just sitting in feces or sitting in urine, and like you automatically have like a big task to do, and which I understand like that's not like your guys' priority in the ER, so I get it and I just take it with whatever it is. But if in my perfect world, you guys would come up and your lines would be labeled and your sheets would be you
know, honestly, like when I take a patient up, if they're soiled or something like that, I always try to make sure, unless something's happened on the way up.
Yeah.
Like I have
it always happens on the way up.
Yeah, it always happens on the way up, exactly. But I do try to keep it like clean, like before. I mean, that's just because somebody did it to me, I'd probably call them and be like, all right, why'd you do this? You know. But yeah, it happens. I mean, I would definitely say I try to do that. I try to make sure, but like you said, it always happens on the way up.
Yeah, and like I think that if you take anything from this video, whether you just laugh or whatever, it's just like both roles are super important. It's a super important part of the process for a patient coming into the hospital. And like I think some people think there comes this like negative stereotype between ER and ICU nurses where people are like, I don't like ER nurses, they do this, or I don't like ICU nurses because they're this way. But like when it comes down to it, like we're both super important parts
I don't like
of the
ER nurses, and I am an ER nurse.
You don't like anyone.
No, I hate everybody.
So like just like understanding that it's both. Both roles are important, and like I respect your role and you respect my role, and all is well in this world.
Yes.
Preach. Anyways, got anything else to add?
Nope.
Alright, make sure you check out Crosby's channel, The Nomad Nurse, because he's going to be doing videos and vlogs from this trip, and he also has a lot of other great content out there. Yeah,
and I'm about to drive across the country, and I'm going to be vlogging pretty much every day, show y'all the setup. I don't know, it's so hot down here, so I haven't been, sleeping in the Jeep is different when it's extremely hot, and so I don't know how that's going to work yet. You guys follow me, we'll figure something out.
Make it sound like you're sleeping in the Jeep here. He's in the driveway sleeping in his Jeep.
No, they actually let me stay here in a bed with air conditioning.
And you have a fan.
Yeah, and I have a fan.
And we feed you.
Yes, you did. And got me drunk.
Yeah. That's a true story.
It is.
Alright, well thank you guys for watching, and we'll see you I will see you in my next video. Bye.